When can an average-risk woman safely stop routine cervical cancer screening? At age 65, provided she has had adequate prior negative screenings and no history of high-grade lesions. What is the current USPSTF screening age framework for a woman with an average risk of breast cancer? Biennial, every 2 years. Mammograms starting at age 40 through age 74. What is the preferred oral first-line agent for managing gestational diabetes when lifestyle modifications fail? Insulin. Oral agents like metformin or glyburide cross the placenta and are not preferred first-line. What is the target therapeutic range for magnesium sulfate when managing a preeclamptic patient? 4 to 7 milliequivalent/L. If the patient loses deep tendon reflexes or develops respiratory depression, administer calcium gluconate. A patient requests emergency contraception 4 days, 96 hours, after unprotected intercourse. What is the most effective oral option? Ulipristal acetate, effective up to 120 hours. Levonorgestrel, Plan B, loses efficacy significantly after 72 hours. What non-hormonal, first-line pharmacotherapy is highly effective for reducing moderate to severe menopausal hot flashes? SSRIs or SNRIs, e.g., paroxetine or venlafaxine, or gabapentin. A patient presents with a homogeneous, thin, gray vaginal discharge with a fishy odor. Clue cells are seen on microscopy. What is the treatment? Bacterial vaginosis, BV. Treat with oral or topical metronidazole or clindamycin. No partner treatment needed. What is the quantitative beta-HCG discriminatory zone threshold above which a normal intrauterine pregnancy should be visible on transvaginal ultrasound? 1,500 to 2,000 myo/ml. An empty uterus above this level highly suggests an ectopic pregnancy. What is the most common cause of abnormal uterine bleeding in a 16-year-old female who recently started her menses? Anovulatory uterine bleeding due to an immature hypothalamic pituitary ovarian axis. What is the first-line medical therapy to control acute, heavy menstrual bleeding in a patient with no contraindications? Intravenous conjugated estrogen or high-dose oral contraceptives to stabilize the denuded endometrial lining. A 26-year-old female presents with severe cyclic pelvic pain, dysmenorrhea, and dyspareunia. Nodules are palpated on the uterosacral ligaments. What is the diagnosis? Endometriosis. Diagnose clinically or via laparoscopy. Treat first line with NSAIDs and continuous oral contraceptives. A postmenopausal woman is found to have an asymptomatic 4 cm adnexal mass. What lab test should be ordered to help evaluate malignancy risk? CA 125 level. While nonspecific in premenopausal women, it is highly predictive of epithelial ovarian cancer in postmenopausal women. A patient presents with severe, unilateral vulvar pain and swelling that prevents her from walking comfortably. Exam shows a fluctuant 4 cm mass at the 5 o'clock position. What is the treatment? Bartholin gland abscess. Treat with incision and drainage followed by word catheter placement to prevent recurrence. What is the standard diagnostic definition of infertility, and what is the first step in the workup? Inability to conceive after 12 months of unprotected intercourse, 6 months if age greater than or equal to 35. First step is a semen analysis. A patient presents with intense vulvar pruritus and a thick, white, cottage cheese vaginal discharge. Vaginal pH is 4.2. What is the treatment? Vulvovaginal candidiasis. Treat with a single oral dose of fluconazole, 150 milligrams.